broadcasting live 4 days a week worldwide
from the sunny beaches of Southern California.
This is ExtremeHealthRadio.com.
This is Dr. Bradley Nelson, author of The Emotion Code, How to Release Your Trapped Emotions for Abundant Health, Love, and Happiness. You're listening to Justin and Kate on Extreme Health Radio. For more information about the Body Code, visit ExtremeHealthRadio.com/Body Code.
Thank you so much, everybody, for being on another show of Extreme Health Radio. Really enjoy that you guys are on, and there's a lot of people in the chat room, so we appreciate that. A lot of fun to do these shows, especially when there's people in the chat room.
I know, right?
Yeah, it just makes it more fun.
I know, it's totally fun.
It just makes it way more fun. So thank you. And this is episode, let me see here. 249. And actually, Dr. HInes, we're going to have him on in just a second. He was on episode 96 back in, I think, May of last year, wasn't he?
No, that was a year ago?
96, yeah.
Sheesh.
So we'll put a link to that one as well. We'll be introducing him in just a minute, but we want to thank all of you guys for listening. We broadcast live 4 days a week on Monday, Wednesday, Thursday, and Friday at 9 a.m. Pacific. Basically, what we do is we take Tuesday off. So that's kind of our thing.
But it's not really off. It's just filled with other things.
Filled with other things. So Monday, Wednesday, Thursday, Friday, 9 a.m. Pacific. And so you can join the chat room that way, and you can listen to the show live. And then on our Friday show, you can actually call in and talk to us. And so that's a lot of fun, too. So please join the show that way. And if you guys would like to send us an email, you can do that at justin@extremehealthradio.com.
Or send one over to Kate at extremehealthradio.com.
And let's see what else. You can send voicemails in to the guests. You can pre-record those on your computer if you like. That's a great way to send in your voicemail questions to the guests. That way they can actually listen to you, and you can make sure it sounds good. And also, we are 100% listener supported, so if you guys make any purchases on Amazon, we would greatly appreciate it if you guys could go through our link every time you do that, and that's just extremehealthradio.com/Amazon, and that will help keep the show free for everybody else, so no one has to pay for this content. That's our goal, is we don't want to have anybody have to pay. So if you guys go through, and you don't have to buy anything else health-related, you can just go to our link. It's on our website as well, to Amazon, and then that way you can support our show. It's a beautiful day here in Southern California.
Oh, my gosh.
It feels like it's about 90 degrees already, right?
Yeah, it's 9 in the morning, and it's I think I looked at the thing in the kitchen. It said 92.3.
Yeah, we're getting some
already.
Kind of real crazy heat storm here.
Yeah.
Santa Ana winds, and
it's a little rough. Us Californians aren't used to that.
We're so spoiled here in California.
I know, right?
So Dr. Stephen HInes, he's in Texas, and he's a naturopathic doctor, endocrinologist, master herbalist. He specializes in natural, I should say, let me pick the word correctly here, not cures, because no one can cure cancer. We all know that.
How about help?
He helps people with cancer, we'll say
there
that.
There you go.
And using natural methods to be on the up and up. So he has been practicing this kind of medicine, naturopathy, for 15 years. He's been doing all kinds of work lately, workshops and all kinds of stuff. And he works with people with gastrointestinal diseases. He co-authored The Road to Health, which we have actually, a DVD, a great DVD.
That is one of the best DVDs.
If you want to learn how your digestion works, he goes through the entire process of eating food and where it goes and what it does and how it's used. It's incredible. It's a live seminar he gave, and he has over 12,000 hours of training in nutritional biochemistry, anatomy, physiology, and just amazing guy. And his website is hopewellnesscenter.com, as well as hopewellness.com. I believe, Dr. HInes, you're on the road right now. Is that correct?
On the road again.
I love it. Where are you traveling to?
Well, actually, today I'm in Brackettville, Texas. I'll be headed over to Mexico to my clinic. As soon as we get done, I've got a couple of cancer patients over there and a Parkinson's patient and an ALS patient, and good news is they're all getting better.
Wow. So how often do you travel to your clinic in Mexico? Because you have your center that's in San Angelo, right? And then a clinic in Mexico.
Yeah, in San Angelo, as a traditional naturopath, Texas doesn't have any kind of naturopathic medical boards. So all I can do in Texas is nutritional counseling and diet and lifestyle, kind of detective work. But in Mexico, where I have a medical doctor as a partner for 19 years now, we can use anything on the planet that's long as it's approved in a developed nation and we are certified in it, then we can do it. So I'm over there Monday, Tuesday, and Wednesday of each week. Wednesday's kind of my swing day. If we're real busy, I'm in Mexico. If I'm not busy, then I may go back home to San Angelo.
Okay. And how far apart are the two offices?
About 180 miles.
Okay.
Wow.
So if someone wanted to come see you, they would first go to the Texas office, and then if they needed to, they would go to the office in Mexico.
Yeah, it really depends on what's wrong with them. If it's something simple, little health guidance, they could come to Texas.
Okay. I was always curious.
If they've been diagnosed with cancer or ALS or MS or something like that, then we do the IV therapy in Mexico. So we just we discuss it on the phone when they initially call to decide where is the best place for them to go.
Interesting. So I actually have a friend whose father is diagnosed with ALS right now. Do you see a lot of people with ALS?
Beginning to see a lot more than we used to. We might see one every 3 or 4 years, 10 years ago, and now we're seeing maybe 3 a year or 4 a year. But we begin to understand a lot of what's causing it now. So although I can't tell you that we've had 20 people come and 15 of them are well now, I wished it was that way. The problem with ALS is that regardless of what causes it, which is a number of things, they're usually in such an extreme state when we get them. They're on a ventilator or almost. They're on oxygen. They can't walk. They can't talk. They can't breathe. So even though we have begun to turn them around, so many have been in a wheelchair for a couple of years, and 2 of them through blood clots because of being in a wheelchair. Another guy who was getting much better took a weekend off, went home to Amarillo, Texas, and he started having breathing problems. So his wife took him to the hospital, and they said, "Oh, it's just the progression of the ALS." And she said, "Well, but he's been getting better." And of course, they didn't believe that. So it's not just the progression of the disease. Well, 3 or 4 days later, he's just obviously got something going on. Takes him back to the hospital, and he had double pneumonia.
Oh.
And ended up dying of respiratory failure.
Oh, my goodness. Wow.
Even though he's getting better and better and better. And we had another gentleman who was very, very advanced, could barely talk, had a 24-hour caregiver. And his was caused by Lyme disease. And
you mean his ALS was caused by Lyme disease?
Yeah, which oftentimes it is.
Huh.
So, when you're treating Lyme disease, people pretty much always get worse before they get better, because as you kill off the organisms, there's 1,000 blebs, little bumps on the membrane of Borrelia, and when they shed off, the immune system attacks them, and you get a lot of inflammation, and this, they're hyper allergic to everything, and they don't get any exercise because they can't walk. And this guy was with us a few weeks. He was getting better, needed to take a week off, which no more. I mean, anybody takes a week off, something bad happens. But we actually had his primary care doctor call in an order for nighttime oxygen because he was having a hard time getting his breath. Well, instead of bringing oxygen to him, the home health agency put a 24-hour Holter monitor on, a pulse oximeter.
Mm-hmm.
And next morning, his wife called me and said he was in ICU and they didn't expect him to make it. And I said, whoa, what happened?
Yeah.
Didn't the oxygen work? And she said, oh, they didn't bring the oxygen. They bought this gadget to test his oxygen. Well, I'd already tested his oxygen and I knew that his O2 sats were low. So when we monitored the O2 meter overnight, we actually got to see him die because of the ignorance and actually the home health agency that supplied oxygen disregarded the doctor's orders. I mean, the guy didn't care if his Medicare paid for it. He had lots of money, and it wasn't worth his death. And so that was another tragedy. So now I've seen a pneumonia. I've seen 2 DVTs that occurred as a result of their extreme end result of their pathology. And then this case where the guy, we had to watch his O2 sats go down into the 60s at 2 or 3 in the morning.
That's just crazy.
So we're really getting to the point where we know a lot of the time what's caused the ALS. But treating them when they get that far down the road is just so complicated, and they're usually really close to death when we get them.
I imagine if you got people, whether it's ALS or any other disease people have, I imagine if they were to come to you and see you at the early stages and not be circumvented by the medical industry, not kind of doing the dancing in both worlds, I imagine you could do a lot of good things for people.
Well, we have actually reversed 3 or 4 ALS patients, and they were obviously, these were Lyme disease, neurological Lyme was their problem, and they were in good enough condition that they could endure the Herxheimer reaction, which is common when treating advanced Lyme disease. Mm-hmm. I've consulted on some cases also that I understand that the patient did get well, although I haven't talked to the physician in years that actually treated them. I just told them what I thought was a problem, and they followed up on it and said, yeah, you're right. They had Lyme or they had a dental infection.
Mm-hmm.
Saw one recently that was just terribly tragic. A woman had her first ALS symptoms within 3 weeks of having 2 root canals extracted, and implants were put in place. And when we did a cone beam scan on her, which was a digital CT scan of the skull,
mm-hmm.
you couldn't even see her left sinus cavity because it was occluded by a big granulomatous mass. Her jaw was all black.
And this was caused by the implant, you think?
Well, the implants, plus she had another root canal she didn't know she had.
Oh.
And unfortunately, because of her advanced state, no dentist could work on her.
Wow.
She would panic. She couldn't breathe. They couldn't move her head back to get to get into her mouth. And so that's very recently. It's very sad because it really would require an oral surgeon, and nobody would do it. I talked to a number of them to see if they would do it, and they said no way she would make it through the surgery.
Wow.
Oh my gosh.
And she was obviously not going to a biological dentist, right?
No, that's not.
Yeah.
That's not who did it to her.
Yeah.
It was biological dentists that were going to try and repair it, but when they looked at her condition, they said no way.
We have a listener question here from Karen, our friend Karen. She says, hi, Stephen. It would be great to hear what you recommend for methylation challenges. I'm currently managing Lyme symptomology, mercury toxicity, candida, and parasites, and alternating between methylcobalamin, folinate acid supplementation, and a homeopathic drainage formula called Pekana, Pekana, from Germany. Herx can still be so ass-kicking, so help. Also curious to know your opinion on the value of, how do you say this, phosphatidylserine? Is that correct?
Phosphatidylserine.
Okay.
and there's phosphatidylcholine, which we do intravenously at our clinic when we have Lyme, pretty much any kind of central nervous system issue. We do IV phospholipids. That's easier to say, phospholipids.
That's easy. Yeah, I like that.
Categorically. And one thing to say to Karen is she'll go to my website, drfeelgood.com.
I don't know if I want to go to that one.
No, that's a joke. That's a joke, folks. That long story how that came to be.
We were joking before the show started.
One patient came to Mexico just feeling awful, terrible. And, she had a miraculous response, so she dubbed me Dr. Feelgood. So
I love it.
So you respond to it.
Funny. So it kind of stuck, It can easily be misinterpreted, though. So here's what I would do, Karen. Go to our website, hopewellness.com, and click on the gallbladder, click on information, and then scroll down the links till you get to the one that says gallbladder liver flush instructions, and pick option number 4.
Okay, let me do that.
Gallbladder liver flushes are heroic for getting rid of the Herxheimer reaction. The other thing I'd recommend is the Z Naturals product, which is an excellent heavy metals chelator, and it's a non-biochemistry related compound. It actually is a physical binding agent, very unique. It kind of traps metal ions and excretes them, but it also is very good for picking up Borrelia toxins, keeping them away from the immune system. The other thing is Allergy Research Group makes a product that we helped to do some of the early work on. Before it was a product, it was just a big pile of stuff, and they said, we think this will do what you're wanting, and it's a substance that's nanoparticle chitosan, which is derived from crab shells.
Is that the actual product name itself that you can look for?
It's actually called microchitosan. Some people say chitosan because it's spelled like Chitosan.
Okay.
And those that goes into the bloodstream and actually absorbs exotoxins and endotoxins, and that also is heroic. I kind of minimized the methylation issue. I wasn't sure what she was actually saying about a methylation challenge. That's kind of highfalutin talk there. I'm not sure if that's really what she meant.
Yeah, because she just says, what can you recommend for that? So it's...
if people have an MTHFR problem, and I'm going to say the 80 or 90% that are somewhat rank and file, we usually use Metnex, METANX, and that's a pharmaceutical agent. It's really just methyl B12, methyl B6, and paradoxal 5-phosphate, and they're stabilized in this pill for a couple years. And that's the problem, and it's heroic doses of folate, and I think it's 2 milligrams, maybe 4 milligrams of dihydrofolate, which is very, very unstable once you convert folic acid into dihydrofolate. It doesn't last very long potency-wise. So Metnex is a very sneaky product that they figured out how to stabilize it for 2 years. And that's really our go-to. I don't like the synthetic green dye that they use on it, but we've actually had some people just open the bottle, put it in some water, and wash off the green food coloring.
Oh, funny.
So some people react to it. But for the Herxheimer reaction, those things are heroic. I mean, that's going to take care of 90% of Herx reactions from Lyme treatment.
Okay, and we're going to take a little break here in just a second, but wanted to follow up with the tail end of her question, which is, what do you think the value of is on the phosphatidylserine?
Well, it's very valuable because most people, when you're a baby, your cell membranes are about 95% phospholipids, and by the time you're 60 now, they say you're down to 5 to 10%. And if your cell membranes lose phospholipids, you lose fluidity, you lose the structure and the function of the cell membrane and the receptor activity you lose the gates and channels, don't work right, toxins can't get out, nutrients can't get in. So that's something we recommend for everybody, whether you're taking it by mouth or if you're doing it IV. If you're not in a big hurry, taking them by mouth is great. It helps to really clean up your liver. In fact, it's part of our liver protocol on the gallbladder liver flush, is we actually have people taking pretty heroic doses, like 3 grams a day of phospholipids.
Oh, wow.
During the flush, because it helps to digest away a lot of the fatty substances in the liver. So you thin the bile out with some agents that are in that protocol, and then the phospholipids help to get rid of some of the fats that are stored in the liver, that are particularly the trans fatty acids that we're trying to dissolve and get them out of the liver. And so then when they do the end of the flush is where they take 8 farm fresh organic egg yolks, mix them into some cold pressed sunflower oil and a couple of limes, the juice of the limes, fresh. Whip them up with a spoon in a bowl and drink them down, and that stimulates bile flow radically.
Really?
And because you thin the bile out for 3 or 4 days in advance, you're going to actually remove a lot of toxins from the body with that.
A lot of people use is it cherry juice or cranberry juice? I forget.
Grape.
Or
grapefruit.
Well, but the black cherry juice
that's right.
is for kidney issues. So if they have kidney stones, genitourinary tract infections, the D-mannose sugar that's in that, you can absorb it in the bloodstream, but you can't metabolize it, so it rides out the urine. And it's kind of like the bacteria look at it and say, hey, let's jump on that sugar molecule and eat it, and they end up just riding it out of the body.
Ah, I see. Okay. Well, we're going to take a little break here with Dr. Stephen HInes, and for those that are listening live, this is episode 249, and I don't think I referenced the date, which is May 14th, right? 2014?
Yeah.
Is that correct?
You got it.
I got it.
Wow.
All right. And this is episode 249. We're going to take a little break, and we're really going to ask him some good questions. We're going to talk a little bit about cancer on the way on the other side of the break, as well as got a couple more listener questions about mold and fungal issues with in relation to cancer and biopsies and things. So lots to get to with Dr. Stephen HInes. His website is hopewellness.com and hopewellnesscenter.com. And Kate, you've been doing some work with Stephen HInes recently.
Oh, I'm so blessed to have been, yes.
Yeah, we'll talk about that maybe at the end of the show.
Sounds good.
Lots of good stuff going on. So make sure to visit his website, hopewellnesscenter.com, and we'll be right back right after this break. If you are currently using any hair care products that contain dyes or colorings, these things can be carcinogenic. You see, anything we put on our skin, even in the shower, gets into our bloodstream and causes a toxic overload to our organs over time. That's why we only recommend Morocco Method hair care products, because they're 100% chemical free, 100% organic, raw, vegan, and even wild crafted and picked according to the lunar cycles. Listen to what our guest Anthony Morocco says about foaming agents in the shampoos.
Well, number one with hair care is the sodium lauryl sulfate, which is a foaming agent, which is really carcinogenic, and it's very, very toxic. So that's number one, and so they're so afraid of it. The industry has made 38 different names for it. They've created cocamide, they've created coconut, they've created palm oil, but anything that foams is sodium lauryl sulfate. So I would say that you really need to read your ingredient lists, and if you cannot pronounce the word, it's made in a laboratory.
So would even organic hair care products that foam, would those be damaging as well?
Yes. Organic really today is not what it used to be, so it's just the word. It really, to me, is not reality. If you want a real product, you want to look at wild craft.
As a former hairstylist, I love Anthony's products. If you'd like to have truly healthy and luxurious hair, no matter what your texture, go to extremehealthradio.com/MM for Morocco Method, or see it in our store. Again, that's extremehealthradio.com/MM to learn even more.
If you have any digestive problems whatsoever, I highly recommend getting a Squatty Potty that sits right underneath your toilet. Squatty Potties help give relief from constipation and bloating, hemorrhoids and straining, IBS, pelvic floor, and bladder issues. See, as humans, we are designed to squat when we eliminate, and when we sit on a toilet, that angle kinks and pinches off the puborectalis muscle in your colon, and the squatty potty opens the colon to eliminate more quickly and completely. Listen to what Daniel Vitalis has to say about that.
One of the reasons I love to promote the idea of the squat toilet is because, for a couple of reasons. One, there's a ligament that wraps around your colon that prevents you, when you're in the seated position, from being able to have an effective bowel movement. But that ligament's loosed when we're in a full squat. So people are fighting their own body to defecate this way. Now, in the rest of the world, people defecate in the squat. Use a squat toilet. I'm so big on this. I've got a video on my website about that. But I really believe that it's important we start to actually defecate in an anatomically correct position. So, nobody sits on chairs to defecate except people in the West. And we have more rectal and bowel problems than anybody, more constipation than anybody. But this actually puts our body in a disadvantageous position for trying to go to the bathroom. So if you don't have a squat toilet or don't want to invest in one, I don't know, stack some books up. But get something where you can actually squat up above the toilet, or at least get your knees up higher.
Justin and I love our squatty potty. Start improving your digestion and elimination today by going to extremehealthradio.com/squat or see it in our store. Again, go to extremehealthradio.com/squat and watch the video to learn more.
100% listener supported. Extreme Health Radio. Opening minds and transforming lives worldwide. Don't forget to join our thriving community for health tips, inspiration, and show updates at extremehealthradio.com/Facebook.
All right, we're having a good time here with Dr. Stephen HInes from St. Angelo, Texas, where I'm sure it's about 20 degrees hotter there than it is here.
Hotter and blazes.
That's right.
I'm sure.
His website's hopewellnesscenter.com and hopewellness.com. You can find out about what he's doing on those websites. This is episode 249, and we broadcast live Monday, Wednesday, Thursday, and Friday at 9 a.m. Pacific. If you'd like to join the chat room and get your questions answered, got a lot of people in there today. It's a lot of fun when we have those people in the chat room. It's just great. And if you guys have any questions about the Morocco Method hair care products, we had Anthony Morocco on the show. He's a great guy, and as well as the Squatty Potty. We use both of those, and just great products. I just love supporting these companies and promoting products that we use and we love and we think are just amazing.
And heck, who doesn't like to say squatty potty? That is the best.
All right.
So silly.
So we're with Dr. Stephen HInes. And so, Dr. HInes, I think what we'll do is we'll just read another listener question here. I actually got a couple more. I'm not sure who this one is from. They didn't put their name, but the person says, "Hi, Justin, could you please ask Dr. HInes about tumor biopsies for people who have a history of mold exposure or fungal issues? I think I heard him speak several years ago regarding the limitations and possible misdiagnoses regarding how biopsy specimens are evaluated for cancer versus fungus. Thank you so much."
Well, that's a good question. First of all, if you do have a tumor and you poke a needle into it with the express purpose of drawing tissue out of the mass through the peripheral skin, isn't that really the strictest definition of a metastasis?
Right.
Aren't you trying to metastasize the tumor tissue to the needle and draw it out? So, there is now, it's kind of a no-brainer. You didn't need a scientific study to figure that out, but there is now, I found a couple of references to show that there is a 136%, I think is approximately right, increase in metastasis in breast cancer with a fine needle biopsy.
Oh, really?
And to really, we've seen so many of these breast cancers, some lung cancers, some colon cancers that were actually fungal masses. And so when I asked the pathologist about it, I said, how do you misdiagnose someone? You're looking at this tissue slide and it's obviously fungus because we treated them with antifungals and the tumor went away. Now, that's certain cases, not all, but and I'm a big believer that fungus can actually induce real cancers. But I said, how do you miss that? And so I said, I asked the first guy. I said, he's a 40-year veteran of pathology. He said, well, I don't know. He said, that's curious to me. And I said, well, when you take this slide, got your specimen, and you stain it with hematoxylin and eosin, which is the standard dye for cancer, and you're wanting the cancer cells to take up the dye, and then they kind of glow in the dark on your microscope, and you say, okay, yep, there's 2 or 3 cells that took up the dye. And I said, is that correct? He said, yeah. I said, so then after that, do you then stain for fungus? And he said, well, I guess if we suspected fungus, we would. I said, well, in 40 years of practice, how many times have you suspected fungus? And he said, never. And so I asked the same question to 2 other pathologists, and they said the exact same answer. And so the last one I talked to, I said, please help me understand this. I'm not being rude. I'm trying to understand where the disconnect is here, because this is a big, big deal. I said, so why don't you stain for fungus just routinely? And they said, well, we're working in a hospital, surgeon's in the other room, he's standing there waiting with anesthesia on the patient and waiting for us to say yes or no, there's cancer, and that's all they ask for. We're not in the thinking business, we're in the doing business. We do what we're told, and that's it. We do 50, 60, 100 slides a day.
And this gentleman actually told you that?
Yeah, it was actually a lady.
Wow.
And the first guy that I talked to about it drove him crazy for a long time, because he never even conceived of such a thing. And he actually took it upon himself to figure out, why this was occurring. And, I gave him a hint. I said, what would make you think that someone had fungal pathology? He said, well, I guess if there were inclusion bodies in the specimen. And I said, what inclusion bodies are you looking for? And he said, well, probably natural killer cells or T cells. And I said, well, there's probably the problem is that's old immunology. We now know that it's not the natural killer cells that are responsible for the primary surveillance of cancers. It's actually macrophages. And the macrophages, if they were in that tumor block, they would never see them, because the H&E dye is taken up by nucleic acids, which are not in abundance in macrophages, only in cancer cells. And the other issue is, if you take a golf ball-sized tumor mass and they see 3 cells that take up the dye, well, that's 3 cells out of trillions.
Right.
So I said, well, what are the other trillion cells? And all 3 of them said, I don't know. I've never even thought about it. We just see the stain, takes up the dye. We say, yep, it's cancer, and they cut it out. And so it put me on a long journey, because I just knew that fungus was involved here. And if I had a golf ball-sized mass, and only 2 or 3 cells took up the dye, might I conclude, as a simple-minded guy that I am, that maybe whatever those other trillion cells are, let's say they were fungal or mycobacterium or mycoplasma or coccobacilli, which is cat scratch fever, which often mimics tumors. What about the possibility that the environment created by that infection is what caused those 3 or 4 cells that were actually cancer cells to become so? And if you killed off the infection, might that environment change enough that the body would go back to working normally immunologically, and you wouldn't have a cancer problem anymore? And this particular guy, who's very, very open-minded, he said, man, he said, I'm retired now. And he said, but I wish I wasn't. He said, you just have so stimulated my mind to new thoughts. It's really embarrassing. He said, all these years that I've done this, and nobody's ever brought up this subject.
The wild thing is that what you're doing is just asking simple questions.
Right.
You're just asking what the layman would really ask,
Well, I'm no biochemist. I'm not an immunologist. I know a little bit about everything, but I'm not everything about anything.
Uh-huh.
And so I just look at things logically and say, this doesn't overall make sense. And, and the other things that I've seen 6 triple negative breast cancers that were already diagnosed as such. And we had thermography performed on the breast, but I always do a headshot the first time. And actually 6 out of 7, 6 were positive, showing a root canal tooth or an infected socket on the right or left mammary meridian.
And so that would be on the same side as the breast that had the problem.
Yeah. So let's say it's either the canine tooth or one of the incisors on the lower jaw.
Okay.
And in 6 out of the 7 cases, it lit up like a Christmas tree with a white line, obviously indicating heat, right down to their breast mass.
Oh, my gosh.
And a white line right over to their axillary node masses. So
these white lines are actually just kind of like rivers that kind of point you to where the actual mass is?
Yeah, they're vascular channels or lymph channels.
That's amazing.
Some, acupuncture channels are theoretically microvascular channels. And what we believe is that their tumor started as a result of the endotoxins leaching out of the root canal tooth or out of the cavitated socket, which is a socket where a tooth was infected, and they just, as in conventional dentistry, they just pull the infected tooth, but they leave the infected socket. And when it closes over, it traps the infection in there so that, it's there forever.
And there's no white blood cells that gets there, right?
Or there's no immune system in that focal infection.
Okay.
Because normally in normal tissue, you have an artery, an arteriole, and a veniole, and lymph system. Every micrometers apart, and so here you've got a socket that's potentially half an inch or an inch long sometimes, and there's no vasculature there, just the wall of that infection, and the minute amount of capillaries. There's no way it can support that amount of infectious mass. So if you don't remove the dental ligament, that infected socket, then you've always got an infection there to deal with. And statistically, a friend of mine did a study over about 3,000 sockets that he opened up over many years. He was an oral surgeon. And he sent those, some of the exudate from the surgery to a laboratory, and 96 or 94%, I can't remember. Anyways, above 90% of those sockets had pathogenic infections.
Yeah, I've heard that some of the compounds that they've found in those sockets are so toxic they kill rats on almost on contact. And
well, in one study that was done, I believe it was done by Boyd Haley at University of Kentucky at the lab, used to be called Affinity Labeling Technologies. They took thousands of root canal teeth, crushed them into powder, and put them in 80 different wells or petri dishes or test tube for layman's purposes. And they put enzymes in those wells that are essential to run the human body. The Krebs cycle enzymes, the urea cycle enzymes, the ammonia cycle enzymes. And they put a little bit of this powder from all these teeth. And I believe the statistic was 1,888 out of 1,889 teeth. The endotoxin shut down every single enzyme, minimum of 55% on upwards to 100%.
So it's basically these toxins just shut down all the enzymes that were supposed to be there.
Yeah, in my humble opinion, since I rarely ever see a cancer patient who does not have root canal teeth, and most often on the appropriate acupuncture meridian corresponding with the prostate or the ovaries or the breast, that didn't have a dental infection. I can count 2 or 3 out of 20 years.
That's amazing.
I've personally experienced that in the last few months, actually.
Yeah, you've had some pretty good results. We were, for those that don't know, we were just in Texas visiting Dr. Stuart Nunley, is his office, and he extracted our root canals, 2 of mine and 1 of Kate's, and he's going to do a pathology or not a pathology, I guess a test of the substances that were found in my sockets in the root canal. So we're going to
I can't wait to get that.
Well, yeah, we'll have him back on and talk about that, but it's just fascinating, isn't it?
Yeah, so in my opinion, in bad dentistry, infected dentistry is probably one of the most common causes of disease, period. Chronic incurable type diseases from ALS to multiple sclerosis, arthritis. I've seen 35 to 40 now type 2 diabetics totally resolve their blood sugar issues after removing a couple of root canal teeth.
Isn't that crazy?
Wow.
I mean, it doesn't surprise me. We've heard that a lot.
I saw a woman in a wheelchair that had a very rare neurological condition that after sending her to a dentist and having all these infected teeth out, now it took a while, it took about 3 or 4 years before she became totally normal. Mm-hmm. She went from wheelchair to walker, from walker to crutches, from crutches to just a brace on her legs, and now she runs a health food store. She's totally normal.
Oh, wow. Yeah, it's a long road, but man, it's so worth it, isn't it?
Yeah, and so the general rule of thumb is never, ever, ever get a root canal tooth, because it's a dead, rotting carcass stuck in your jaw.
That's infected too, right?
And infected, yeah, and it's putting out endotoxins that can shut down all these enzymes. In fact, one study I read years ago where they incubated macrophages, which is a primary immune cell in innate immunity, with these endotoxins, and it killed the macrophages.
Oh my goodness.
So when they tried to digest these endotoxins, it killed the immune cells. So in fact, one study, they took this toxin, heated it to 3,000 degrees Fahrenheit, and they retested its toxicology, and it made absolutely no difference. So you can't denature them with 3,000 degrees Fahrenheit, so how do you think that your immune system is going to overcome it?
Yeah.
It's not going to happen.
Yeah, the teeth are a major, major, major issue. That
we always used to say in the salon, we'd joke around and say, friends don't give friends mullets. Now I'm thinking, friends don't give friends root canals. Imagine being a dentist not knowing that you're giving all these people root canals. I mean, that's a hefty thing to live with.
I work with a lot of biological dentists, and Stuart Nunley is one of them. Dr. Stanley, the Stanley father and son in Marble Falls, and then we got Dr. Wilkie in San Antonio, Dr. Glaris in Houston, Dr. Sprinkles, and Dr. Cole up in Dallas. And amongst those guys, referring people to them over the years, we're now up to 28 Parkinson's patients whose tremors and shakes totally resolved.
Oh.
Just as a result of that.
By getting rid of infected dentistry, very often in the Parkinson's type presentations, it's the upper right and or upper left wisdom teeth sockets.
Really?
Because if you look at physiology, the trigeminal nerve crosses over between, I think, the third and fourth molar or the first and second molar. Always get those backwards. And so you've got less than a millimeter distance between a focal infection that's putting out all these endotoxins and a potential nerve channel that can just suck those toxins right up that nerve up into the substantia nigra, into the brain.
Wow, it's amazing, but not. I mean, we've heard that so many times.
Not surprising.
We're with Dr. Stephen HInes. If you were interested in checking out his website, I would highly recommend doing that. HopeWellnessCenter.com and HopeWellness.com. This is episode 249. We're going to take a little break. And Dr. Hines, I have a really long written-in question that I'm going to read after the break. But what I'm going to do is just send this to you via email so that you can take a look at it if you can during the break. And I'll do my best to kind of fish through this and read it after the break. But I'll send that to you now in case you can check that out. But we're just having a very interesting talk here with Dr. Stephen Hines. Really fascinating.
And we'll touch on cancer, yes?
Yes, definitely want to touch on cancer. We broadcast Monday, Wednesday, Thursday, Friday, 9 a.m. Pacific time if you'd like to join us live on the live show. And we will be right back right after this break. I have to say, I have been absolutely loving this product by Tristan Truscott and Peter Ragnar called Good Morning, Good Evening Qigong. If you want to listen to the interview we did with Tristan, you can go to extremehealthradio.com/127. And Qigong is a great way to de-stress the body. And as you know, there's a huge component to disease caused by stress. And stress is a huge factor in how we live our lives and the amount of energy we have and the amount of vitality we have. And so, Dr. Shade, what do you think about Qigong?
People come to me and they're really sick and they got this blown out neurological system and all this toxicity. And I tell them, you need to do Qigong, Tai Chi. You need to do these things that settle down and restore your neurology, because it puts together all the parts. It puts you back into that state where you can start to detoxify. And so I highly, highly recommend all that.
And what about you, Kit Campbell? What do you think about Qigong? Do you like it as well?
Qigong is amazing. And the reason that I believe it to be amazing is everything here is energy. That is a scientific fact, if there ever is one. So when you're practicing Qigong, you're actually drawing energy into your body. Your intention, whatever your intention is behind any action, will determine the level of energy, type of energy that you absorb into your body. So your intention behind is very important, just like thought. So when you're practicing Qigong, you're actually bringing energy in and you're bringing out the stuff that might be a bit stale. With Tai Chi, it's totally different. The energy runs underneath the skin because it's more of a martial. This is the Chinese understanding, by the way. It's more of a martial art. So Qigong is very, very good for bringing that energy into the body, and just fantastic.
If you're interested in picking up this Qigong course by Tristan Truscott and Peter Ragnar, go to extremehealthradio.com/Qigong. That's QIGONG. And you can learn more about it. There's a great video on that page, and you can learn more about it on that page. And I highly, highly recommend this product. I love it myself, so go ahead and check that out. extremehealthradio.com/Qigong.
All free shows, all the time, on Extreme Health Radio. Opening minds and transforming lives worldwide. Join our community today. Sign up to our email list and instantly get our free gift to you, along with loads of inspirational content and cutting-edge tips to help change your life at extremehealthradio.com/subscribe.
Yeah, guys, I would recommend, if you guys haven't already done that, to subscribe to our email list. We send out an email about once or twice a week. I think there's one newsletter that goes out once a week, as well as a show update or show schedule, upcoming shows, or I think it was the past week's shows is that we send every week. So make sure to stay up to date with everything we have going on if you want to join the newsletter. Plus, we send you a free ebook as well, so it's a really good deal. And also, if you have any questions about that Qigong product, Kate and I love it, and we had Tristan Truscott on the show a couple times. Great guy, and it's just a great product, so make sure to check that out. And we have a listener question here for Dr. Hines. It's from Andrea, and it's quite a long question. I'm going to try to do my best to fish through this and figure out what to ask, but I'll start reading it, and hopefully we can get through this. She says, I was bitten by a tick in Germany 5 years ago, the same year I started having hormonal problems, but no doctor gave me the correlation with the bite. It wasn't until a year and a half ago that I had a scuba diving accident and lots of stress that a wave of weird symptoms hit me. I did my best to ignore them until I started getting involuntary muscle movements like twitching, spasms, bubbling feelings, cramps all over my body. I started my Lyme disease treatment combining antibiotics, herbs, and detox, Then as I became more health aware, I started incorporating nutrition from the Dr. Terry Wall's paleo diet, supplements, yoga, visualizations, emotional release, more detox, and reduce my chemical exposure. And she says, I was happy with my treatment plan and watched all the symptoms go away except for the muscle movements, which are now less intense and frequent, and I still get a couple of those per day. Since my plan is to stop the antibiotics I've been taking for the last 8 months and do the rest using natural treatments I've been researching, experimenting a lot, I visit a biomagnetic therapist, which blew my mind. He used a form of kinesiology to place some magnets on my body. Let's see, I told him I had Lyme and annoying muscle problems. This could be a Lyme symptom, but my body was telling him otherwise. Let's see, I'm trying to get to this.
That's long-winded.
This new insight took me unaware, and even though I am certainly keeping all my health and lifestyle changes, I'm suddenly unsure about what step to take next in my recovery. I'm not sure what that should be. I would greatly appreciate your thoughts and advice. Wow, that's a long question.
Yeah, that's a big one with way too many variables, and
yeah.
So I can't give medical advice.
Maybe I should just refer her to your office.
Speaking, she mentioned that the magnetic therapist said that her tremors were due to a tetanus vaccine that she took, which she said does coordinate with the symptoms when they started happening. And surely vaccines can definitely induce neurological conditions. So I wouldn't foo-foo that at all. But I think she needs to get with the physician that's treating her Lyme and just say, look, is there some test you could do? Because Clostridia tetani are what causes tetanus. Mm-hmm. But it's probably not that she's actually would have had that anyway. But she could have just had a reaction to the typical vaccine excipients and binders, and I don't know on that particular vaccine. I know a lot of vaccines have squalene in them, mm-hmm. and squalene, if you stick that under the skin, it's going to drive your tissue macrophages insane, which is why it's there to encourage them to take up the antigen that you're trying to vaccinate against. But many of those vaccines also have aluminum in them as an adjuvant, and some still have mercury, depending on which one you're talking about. And there are many potential other organisms that their DNA or their cell membrane components are in the culture media when they grow the bugs to make the vaccine. So, it's very possible that she's got an immune reaction that's created a neurological condition, but you'd probably need to take that up with her Lyme doctor and have them look at the tetanus vaccine, get the lot number, and find out what all is in it.
Mm-hmm. Yeah, that's the first step.
If it's something like aluminum, then you probably want to chelate the aluminum. One of the problems with the vaccines is the squalene. That stuff, squirting it under the skin, it's just an irritant. And your body actually has squalene indigenously. You make it. It's part of the myelin sheath fibers, I believe, and maybe in Schwann cells. So it's possible that it could have triggered an autoimmune reaction. So, if somebody comes to our clinic and we suspect something of that nature, sometimes what we'll do is we'll just suppress the immune system for a couple of days, give them a couple, 3 milligrams of dexamethasone and see if their symptoms go away. Mm-hmm. Then we know that it's related, it's an immune system relationship. If they don't go away, then it's probably more due to an infection or a toxin. And those are hard things to discern. I hope that she's working with a practitioner that can give her some insight on that. And, I wouldn't be just stopping the Lyme treatment unless your physician, if he's totally conventional, maybe, you might have to find another Lyme doctor who is not so conventional and mm-hmm. do some botanicals. We found, unless it's neurological Lyme, we rarely use antibiotics anymore. Typically, things like miso silver, cemento, Commanda, Banderol, the Nutrimetics products. work fabulously well. I mean, you can kill Lyme as fast as you can stand it, because the Herxheimer reaction is the biggest inhibitor of moving very quickly.
Wow.
So it's just very complicated, and what she could do here any day, any this month probably, the KS3 test will be available. KS3 Labs, labs.com.
KS3 Labs. Okay.
Yeah, and do a triple shot. A big toe stick, a finger stick, and a venous draw.
Okay.
And let's have the lab sequence all the organisms that they find, and then you can know for sure, or at least, not totally for sure because nothing's perfect, but you have a good inkling if there's still something going on with a Lyme organism, because Lyme is well known to cause tremors and shaking and muscle spasms and hormone problems and chronic fatigue and joint issues and cognitive dysfunction. Credits misdiagnosis, 300 different diseases. So I would really not abandon the Lyme issue. Either one could be the problem, but, get some more testing done. Find a doctor that's willing to do some holistic stuff for you.
That's good.
And don't know what area she's in, but she could go to acam, acam.org, and just type in her zip code and find probably a Lyme literate doctor that is integrative, because the ACAM doctors are the most aggressive in integrating conventional with, IV vitamin C and IV magnesium and peroxides and hyperbaric and nutrition, diet, hormones, etc.
Right.
So find a doctor in her area that's maybe a little more broad thinking.
Okay, well, that's a good place to start. You've been doing some research recently, and you actually just had a seminar that you gave. Did that go over pretty well? I think you just had that recently.
It actually went over so well. I was astounded.
Great.
We did this 10-hour seminar in San Antonio at the Doubletree Hilton, which is a wonderful venue if you ever want to do a seminar in the San Antonio area.
Wow.
Asked the McClures for assistance because they really did an incredible job. Their staff was amazing.
That's so great.
And we had a packed house. We had 4 cameras, video crew. And so we videotaped the whole thing, and it will be available. I had 5 hours worth of slides when I got done at 10 hours. I had 2 dentists, actually 3 dentists speaking on biological dentistry issues.
Wow.
And then I have Dr. Donald Dennis, who is an ear, nose, and throat doctor in Atlanta, one of the tops in the country on mold toxicity. He actually is pre-recording 2 hours, and he's going to send it to me, and we're going to add it to the video series.
Oh, my goodness.
When we get through editing, it's going to end up probably being 13 or 14 hours of really hard-hitting, bottom line, everything Dr. Rivera and I have learned. He's my partner in Mexico, and we've been together 19 years. All the tricks of the trade, things that we found that you just aren't going to read in a textbook, step by step, 1, 2, 3, looking at chronic infections, looking at dental, looking at heavy metals, which test to run, which lab to use for different things, which labs to use for like hormones versus gastrointestinal things. We love the diagnostics guys up in Seattle for the GI panel that they do. It's wonderful.
Right.
And Saber Sciences right there in San Diego is my go-to guys on hormones. They're amazing also.
I just finished one at 4 a.m. today.
Yes, Kate was doing her hormone test.
Yeah, and they do that 4 a.m. specimen, which is very unique because what they want to do is see what your cortisol levels are in the wee hours in the morning, because if you're going hypoglycemic due to gastrointestinal problems, that 4 a.m. cortisol will be high. And so that gives you a clue that you need to go and look at your diet, and maybe you got some bugs chewing on your intestines, like maybe Cryptosporidia or Giardia.
Yeah.
Toxoplasmosis. And one of the things the lady mentioned in her email a while ago was she was on schizophrenia meds. Well, one of the organisms that is commonly found on that GI2 panel and it's also very associated with gallbladder problems and gut issues. And schizophrenia is toxoplasmosis. In fact, mainstream studies now are attributing in 80 plus to 90% of the cases of schizophrenia. They're finding toxoplasmosis in their brain.
So they're finding this in their brain, and then that's causing the symptoms of schizophrenia? Yeah.
I mean, you get a bug like that growing in your central nervous system, it's going to wreak havoc. You're going to be seeing bats flying through the roof and ghosts in your head, and you're going to misperceive reality. You're going to be jittery, shaky, spasmodic, psychotic at times.
Wow.
And there's a lot of organisms that do that, and that's why the ks3labs.com is going to be such a wonderful tool for practitioners, because you don't have to know what it is you're looking for now. You just do a triple shot, and they'll DNA sequence potentially hundreds or thousands of potential pathogens, and if they show up, then you know that that's potentially involved in that person's pathology.
So they don't even have to have the DNA. They can just do that sequence and find out.
Well, they are actually sequencing the DNA that they find.
Oh, I see. Okay. Wow.
So the lab they extract the DNA, and then they sequence it and, give you name, address, and social security number of all the organisms they find.
Doc, I was wondering.
So it minimizes the guessing, which is the big problem, because so many of these things overlap. If you look at Leptospira and Borrelia burgdorferi, they look the same, 95% overlapping symptoms. And so on the botanical side, what might work fine on Borrelia doesn't have any effect at all on Leptospira.
Even if there's just a 5% difference like that?
5% difference in the symptoms.
Yeah.
The organism, however, is quite vastly different. I think Borrelia has like 129 genes, and Leptospira has 2,700 genes.
Oh, my goodness.
So it's a much more complex organism, and it's very common, and you don't even have to get bit by a tick. You can get it by drinking bad water.
Yeah, I was going to ask you, what are some of the main ways people are getting these organisms, do you think? Some of the main...
Well, like toxoplasmosis is ubiquitous in the environment, and when it's real dry and blowing hot air around like it is in San Diego today, or in Texas any given day, it's in animal feces, cats, dogs, goats, cows, horses. So if you breathe it in your nose and into your lungs, if you're immune suppressed, you can start growing that bug in you, and it'll go wherever it can go. With your Borrelia family, most people get it from a tick bite, but it's downloaded from mom to baby. That's now been proven. It's a corkscrew type organism, so it just twists its way through connective tissue, into the placenta, through the bloodstream, into the baby's body, and you see a lot of babies that are born to Lyme moms that are born with colic.
Yeah.
And conventional doctors now put these little babies on omeprazole or Nexium and try to shut their stomach acid down to stop the reflux, when the real problem is they got Lyme downloaded from mom, so but any blood-sucking organism, from ticks, bed bugs, mites, biting flies, horse flies, deer flies, all of those things can... anytime you get an infection that's vectored by an insect, we call that zoonotic infection. And that zoonotic infections is like 70% of all the infections that humans get.
Really?
Is via an insect vector. So you can get a lot of bugs, including African sleeping sickness. You can get Chagas disease, which we saw our first case of last year.
What is that?
Gentleman, Chagas is elephantitis.
Oh, my goodness.
It's a protozoa. It's very common in South America and Central America. And it's quite fatal if you don't catch it early on. The leg just swells up. It causes tremendous lymphedema. And we actually successfully treated our first case and only case, and it was pretty big. This guy's leg was swollen to 3 times normal. His feet were so huge, his toes looked like little baby's toes hooked onto an obese person's foot.
Wow.
And we actually topically applied ivermectin liquid, and within hours you could see the little worm crawling up to the surface of his foot. Mm-hmm. And so he just kept rubbing it on way, way beyond what we told him to do. He was quite desperate because he was getting married within a couple of weeks, and the infection was already up to his groin.
Oh, my goodness.
So they were going to have to cancel their honeymoon. So he became aggressive with it and totally wiped out that Chagas disease, which you get from the kissing bug, which is not uncommon, but they don't historically carry that protozoa in America. But after a little research, we found that there's now 300 or 400 cases reported last year of Chagas in America.
Wow.
Chagas, I've never even heard of it.
I know, I'd never even heard of that.
Chagas.
Like the mushroom.
Like the mushroom, yeah.
Yeah, sort of like, yeah.
So if somebody had, if somebody were relatively healthy and they felt good, what do you think the average person who feels, maybe they're 40 years old, they feel good, they feel healthy, do you think most people are walking around with all these organisms and don't know it yet?
Well, a lot of people, when we previously had a lab of the similar nature as KS3, we had it for a couple of years and we had to pull it off the market and rebuild it because it was just too expensive and time-consuming. But we would find people that had Borrelia and they felt fairly normal. So it's way more than just the bug. It's the diet. It's the microbiome of the gut. If their flora is imbalanced, maybe they're eating a lot of grains and they have a lot of yeast in their gut, parasite infections, amoebas, root canal teeth, cavitated sockets, mercury fillings. Those things are generally the larger players.
Yeah, so there's a lot of mitigating factors, and as well as environmental toxins. I mean, you can just go on and on, right?
Yeah, and conventional docs that do treat Lyme, they tend to blame everything on Borrelia when really it's way more complicated than that. You got to deal with the diet, and this young lady went on the paleo diet, which was very smart. You want to get away from the grains. The grains are highly inflammatory. The corn is genetically modified. The soy is genetically modified. The wheat is hybridized. And it's just an immunological disaster with the GI tract. It gets your gut immune suppressed. And then these amoebas and parasites, the worms, the trichinella, the tapeworms, they have an opportunity then to take hold of you and become pathogenic just simply because your gut was trashed from eating genetically modified foods.
Yeah, it's amazing. I often think about how incredible it is that we're able to eat a diet like this for 30, 40 years and seemingly feel good and seemingly feel okay until something happens. But it's amazing. Yeah. It's amazing how you can just kind of eat this garbage food and get away with it. Yeah,
well, if you don't have a root canal tooth poisoning your immune system, you don't have a bunch of mercury. And mercury's a cumulative poison, so the longer the mercury's in your mouth, the more it's going to accumulate. And one day it sucks down your glutathione levels, which recycles your vitamin C, and suddenly you have scurvy.
Oh.
So, it's, people all the time come to the clinic and they say, I was never sick a day in my life until I got cancer.
Wow. Yeah, a lot of people say that, don't they?
Yeah, and when we do a timeline, we find out that was, 2 months after they got their root canal, or a year. There was some traumatic event, a divorce, a business failure, some traumatic experience that preceded caused the immune suppression that then allowed the cancer to grow in their body.
Yeah, I think you
got to look at the emotional stuff, big time emotional things. If you carry around grudges, you hate people, you don't like anybody, your family's mad at you, good luck. You're going to get something because, there's nothing probably more immune suppressing than emotional trauma.
Do you think, Doc, the emotional trauma supersedes in terms of the order and progression of diseases? Do you think the emotional traumas and the stress and lifestyle supersedes the dental issue?
They're a close 1 and 2.
Yeah.
I've seen people that are very happy people that did not have an axe to grind that ended up with cancer after a root canal. And I've actually seen people who had various neurological conditions, fibromyalgia, lupus, chronic fatigue, that within days or hours sometimes of removing those infected teeth, their symptoms were all gone. But then I've seen, because I rarely see anybody who has cancer who doesn't have a root canal, it's hard to tell emotionally, what drove what. But I routinely, or my partner and I both do this now, that when we're doing our initial consult with our cancer patients, we ask them, why do you think you got cancer? And 90% of the time they'll say, well, I know why. Because I went through a divorce and my husband screwed me out of everything and I hate him and I'm trying to get over it, but I can't. But I haven't slept in 2 years and now I can't pay my bills because he took all the money and the lawyer was cruel and terrible and dug up stuff from 20 years ago. And they can tell you why they believe that they ended up in the condition they're in. And I've seen people who were not getting well doing everything we could do, and they go in and spend a couple of hours with our Christian counselor and come out smiling, happy, giggling, laughing, crying because they're so happy, and the tumor starts going away.
Oh. Isn't that amazing?
Yeah, so cancer is a big thing. And one point I wanted to make to regarding cancer is that when someone comes to Mexico and they've got an active malignancy, if we can, now we always test their serum iron, ferritin, and their total iron binding capacity, C-reactive protein, SED rate, all their white counts, and we try to discern, particularly if they have any iron issues. And we find people all the time with cancer that have iron levels in the 300, 400, 500 range. And if they've been through chemo and if they have very advanced tumors like, baseball sized, you'll see their ferritin levels in the thousands.
Oh, wow.
And so we immediately start doing therapeutic phlebotomy, and we'll drain a pint of blood off a week. Ooh. And just to get their iron levels down under their ferritin around 90 to 100. And that is a big prognostic indicator. If we see those kind of thousands type ferritins and we can't get them down, rarely do those people turn around.
Wow.
Golly. So I myself keep my ferritin around 90 to 100. And we recommend that to everyone, is that's a safe thing, because if you take a bag of cereal, which I don't suggest you eat, just do an experiment. Get you a big magnet and pull the plastic bag out of the box, and most of the time you can pick it up with a magnet, because they actually put ferrous iron in the grains, in the milk products. They're adding back nutrients, quote, end quote, that were extracted out during the milling process. And they're actually using a non-biologically active iron. It's actually magnetic iron.
What? So what is that labeled as in the cereal?
Well, it just says iron on the label.
Iron.
And you could pick some of this stuff up with a magnet.
You pick it up with a magnet, yeah.
Oh, my gosh.
Isn't that amazing?
It's scary. And so people have a high-grain diet, particularly the refined grains. It's not such a problem if they're using, whole grains. But the highly milled wheat, they add this metallic iron back to it, and when you absorb that, it creates a massive amount of free radicals. And if you go to YouTube and type in Stephen HInes / the THE Fenton FENTON reaction, I did an experiment in my lab to depict this visually, and you will understand why you do not want iron. Wow. We don't have anybody. In 20 years of clinical medicine in Mexico, we've given iron 3 times.
Oh, wow.
Because when you see this, you'll understand why. It creates a free radical that you just can't control. And if their ferritin level's already high, you already got so much iron your body can't manage it. And infections grow like a house on fire. Bacteria need iron. Cancer cells need iron to grow. And the body does all it can do to manage that iron, but if your ferritin's 400 or 500, it just can't do it.
So how did you say that you keep your ferritin levels down around 90? How do you do that?
Every now and then when I take an IV at the clinic, I'll have them use a pretty good large bore needle, like a 20 or 21 gauge. And when I get done with the IV, I'll just lay the IV bag on the floor and let the blood run out until I fill up the 250 cc bag, and we throw it away.
Oh, I see. Wow.
Oh, wow.
So it's almost like an old school form or a new school form of bloodletting? Is that?
Yeah, it's actually very good medicine. In fact, there's good scientific evidence among the blood banks. They know this, that people who routinely give blood have like a 34% less rate of heart attacks.
Really? Both men and women?
Yeah, and the same thing with diabetes. High iron level lends to diabetes, neurological conditions, Alzheimer's, dementia,
really?
Insulin resistance. No, it's a big deal, and it's one of those simple things that you can just go get your serum iron, your ferritin, and your total iron binding capacity done. You can go to ironoverload.org. They'll tell you how to calculate it to see if you got too much iron.
Okay.
Like I say, I like my ferritin in the 90 to 100 range. There are some idiosyncrasies there that you have to make sure you're not in the midst of an infection. If you have the cold or flu or you're feeling bad, don't do it then, because ferritin is also an acute phase reactant. So it actually goes high during an infection until the infection's done with, and then it relinquishes the iron back into circulation. So, but if you go to ironoverload.org, they tell you how to which test to run.
So do you think it would be okay for people to go to their local lab or whatever and get blood taken like that? Is that safe, do you think?
Well, sure. I mean, it's routine. It's highly recommended by many physicians to donate blood just because it's healthy.
Okay. And we have a listener question from the chat room.
Yeah, one quick one. Tana is wondering if if a test called Spirostat Technologies is available now.
Well, Spirostat is now ks3labs.com.
Gotcha. So that
and it is not available yet. I just checked yesterday. We're jumping through a couple of hoops that the laboratory board is waiting. It's just some reporting. So I hope it'll be soon. Everything is being done that can be done. It just takes time. This is a very elaborate lab, and they hold us to very high standards because it is DNA. It's the highest standards because, think about it. DNA, people go to federal prison for DNA evidence, and you cannot be wrong.
Right.
It's got to be right 100% of the time, and so we have to do all kinds of internal testing, but we're very close. Just keep checking the ks3labs.com. There's a notation on there that says we're not currently accepting specimens, but will be before long. In full and fair disclosure, I am on the board of directors, so I do have an axe to grind there. So
okay, no problem. One final question, and then we're going to let you go because I know you have to go to Mexico. But Tana in our chat room says, what about people that have had their wisdom teeth pulled, and especially if they had dry sockets?
That's a very typical response if they left the dental ligament in. Okay. That happens a lot. It does happen sometimes even when the dental ligament is removed, even by the best of biological dentists. And we can have a protocol that the dentists that work with us do. We have them taking nattokinase, like 100 milligrams 3 times a day, as long as they don't have a known or suspected coagulopathy, like low platelets or something like that. But we'll have them take some Fibro Boost, maybe 1-3 times a day with their natto for a couple of 3 days before they see the dentist to make sure there's good blood flow into that socket.
Okay.
And some of these dentists, like Dr. Wilkie in San Antonio, he has a really elaborate laser that really helps with that. And now a lot of them are doing PRP therapy, and they're also doing ozonated saline and ozone gas into the socket. So among your biological dentists, that doesn't happen that often because they do a lot of precautions. In fact, if it's a really bad cavitation or root canal, they'll put them on antibiotics for a week beforehand.
Wow.
Try and minimize that possibility, but obviously there was poor blood flow into the socket.
Wow.
So you're going to have to probably go back through the process, get on some fibrinolytic enzymes and a bunch of maybe fish oils and get that blood thinned out. Because those sockets themselves create those kind of circumstances. Those endotoxins cause hypercoagulation. So in the process, you've got rid of the infection, but the endotoxins are there and the vasculature around that area is still occluded possibly. So you got to help the dentist out. And, most of the guys that we work with recommend the anticoagulant type therapies in advance.
Yeah, it's like a snowball, self-perpetuating thing.
Yeah, nattokinase and FibroBoost from Allergy Research Group is... we usually take one of each 3 times a day for 3 or 4 days before this dental surgery. And then we'll maintain them for another week or so after, and usually also on antibiotics.
Interesting. Wow.
Yeah, you just don't want those kind of infections to get loose and get in the heart.
Yeah, because they can travel. Yeah, I've heard a lot about that.
And any dentist knows that. Any cardiologist knows that. They'll generally, even some people have a known cardiac issue, they will recommend being on antibiotics even when you get your teeth cleaned.
Yeah, we know that actually. Didn't they used to want to put you on something all the time?
Yeah.
You used to have this heart thing, but no longer.
It's amazing. Yeah.
Wow.
Well, thank you so much, Dr. HInes. I know you're on your way to Mexico, I appreciate your time today.
You're welcome. Enjoyed it.
Yeah, thank you so much. And for those that are listening live, actually, Dr. HInes, hold on the line, and I want to talk a little bit after the live show. But for those that are listening live, we really appreciate you guys being in the chat room and sharing your stories and interacting with us in that way. So really appreciate it. This is episode 249, and we'll be back tomorrow. I can say that. We will be back tomorrow at 9 a.m. Pacific, so make sure to join us for that show, and we really appreciate you joining us, and we'll catch you on the next live episode. Well, thanks, Doc. I really appreciate your time, and I hope you have a good drive out there to Mexico today.
All right. Thank you.
Thanks,
Steve. Okay. Bye-bye.
Bye.
Dr. HInes, he brings a smile to my face.
I'm just giggling.
He is funny, isn't he?
He is hilarious.
Dr. Feelgood. I laughed when he said
Dr.
that.
Feelgood. Isn't he funny?
You got to have fun, though, when you're dealing with terminal...
Such serious stuff.
Yeah, terminal patients and... spirochetes and Lyme disease. You got to have a little bit of fun, right?
Well, yeah. Those are all fun things, aren't they? I have to say, though, I try not to get very panicked or disturbed by a lot of things. But every time we listen to a guest, I think, gosh, he talked about all the insect possibility of the ticks and the bugs. And he mentioned bed bugs. And remember that one time I was bit by a bunch of bed bugs in Sydney, Australia.
Oh, my gosh.
On our last night, we weren't able to get on a flight. Remember that? We had to spend the night at this boutique hotel.
That's true.
Downtown Sydney. Super nice place. But I woke up the next day and had these red bumps all over my bum.
I remember
And they lasted for almost close to a year.
Did they subside at all, or did they just kind of go?
They came and went. They would flare up and go down. And I remember going to a dermatologist and them saying, basically we don't know what it is, but I'm sure it'll go away. Here's some cortisone cream or whatever. And I put all these things together as the beginning of some, pretty hefty digestive issues and stuff. And I just think it along with the root canal, you're 2 strikes against you. So
yeah,
interesting.
It's really interesting when you start getting down to the nitty gritty. You can start putting the puzzle pieces of your life together, and you can start connecting the dots and saying, you know what, I really started feeling bad when this seemingly insignificant thing happened to me.
Right.
Because you think bed bug bites. Right. What's the big deal? But really, it's pretty amazing that But you know what? I suspect that if you're truly healthy, you're doing cleanses, you're taking care of your liver, you're able to kind of endure those types of things. Mm-hmm. But if you're eating a standard diet, and back then you weren't eating as well as you are now.
Oh, I was eating terrible.
Plus you had your root canal, so maybe you had a suppressed immune system, and the bed bugs injected some sort of organism into you or something, you know?
An gray alien DNA. Just kidding.
Gray. I know,
you like
right?
that one?
That was good.
Ooh. But
So
it just gives you a lot to think about. I mean, everyone listening to that show, I'm sure, had some sort of interest piqued. I mean, we were in the chat room joking about, like, we all need a new body. Like, our bodies all have these crazy things. But we were just joking. But we're thinking, gosh, like, anyone who lives, eats, and breathes, anyone that's human has to have some of these issues or propensity to be kind of go down that road in the future. And it's really important to look at all the things, and again, try to get handed a puzzle piece with each episode you listen to, and hopefully be able to put the puzzle together a little more complete, if not complete. But we'll always be just kind of on the journey. But
I know,
fascinating. He knows so much. What did he say his new DVD was going to be, like 14 hours?
Something like 15 hours. I mean,
good night.
Probably have to have a series of. It's probably like a package where you get 5 discs or something.
Right, it's broken up, but still, it's a lot of info.
Yeah, and you know what's weird too is he's probably doing those seminars, and he's probably, cutting down the amount of information that he can put in, because he can't put in everything he knows. I mean, there's got to be some outlet where a guy like him, he should have his own podcast.
Yeah. You know? What are we doing here?
I know, right? I mean, he can dispel and dispense so much information that he can't do in a book because it's too technical. He can't do it in a seminar because it would go too long and bore people. But it's stuff that would change people's lives.
Yeah. That's why as many podcasts as people like him and himself can get on, the better. Because, I'm sure he doesn't have time to do his own weekly podcast. The guy is so busy.
Yeah.
I've had an appointment with him, and my gosh, he just blows my mind of...
you've been working with him.
He digs and he finds things that I never would have thought of. And I've been working with him. He's amazing.
So you did a stool test with him, right?
I did. He sent me he overnighted me a kit. It's like a stool/saliva test. Mm-hmm. Sent that back up to a lab in Kent, Washington.
What was the saliva test? Why is the saliva? Because you're doing a different saliva test now, right?
I am doing a different one. The one I'm doing currently with Saber Science in San Diego or in Carlsbad is for an adrenal test and hormone panel. Okay. The one I did then was to try to find out what kind of critters are living in my gut. The whole thing I did was a comprehensive GI tract test.
And so he actually found DNA of
an amoeba.
An amoeba.
Some kind of fancy name. Yeah, it has a name. It's really long.
Some kind of
fancy amoeba.
And so
little friend.
I wonder if there's lots of amoebas, or I guess if there's one, there's probably many, right?
I mean, I think amoebas are a single-celled organism, but I think they can be all over the place, because he said that could be causing a myriad of other tests to be high.
Yeah.
Oh my gosh, I'm sorry. Once I yawn, you yawn, and then we're good for nothing here.
Oh my gosh. Wow. So
I think the amoeba is getting to my brain.
It could be.
Totally kidding.
Wow. I would recommend you guys check out his website, and I don't know, maybe get some tests from him, even if you're healthy. I mean, it's really, I think, imperative to be all about prevention.
I do too, and I mean, be on the lookout for that KS3 lab test being available, because people in the chat room were talking about really wanting to get that, and that seems like a really good place to start. If not the panel I did, the GI, you can call over there. They're super nice, or you can get online and see what they have to offer, but they offer these different tests, and they're not super expensive. I mean, it's an investment, but the extensive GI panel I did, I think, was $280.
Oh, really?
Mm-hmm.
Yeah, okay.
But it told me, what I needed to know, and it wasn't out of the ballpark, something, it wasn't like $1,000 or something that I'm investing in that just is, seemingly impossible at times to come up with that kind of cash. But it was doable, and I feel like it handed me a piece to kind of put back into the puzzle. So
yeah, because all of these things are just really puzzle pieces, aren't they? They're just little pieces that you can put together from your life and try to come up with some kind of story as to what symptoms you're dealing with and why you're feeling the way you do. It's all just connecting the dots and trying to trying to figure out what the heck's going on with our health and why we feel, low energy, or we have symptoms of, different things. It's pretty amazing.
Yes, sir.
Dr. Stephen HInes.
The journey continues.
He's the He's the top Lyme's guy in the nation.
How honored. What an honor.
Yeah.
So honored to have him on.
Yeah, interesting.
Again and again. He's just amazing.
Yeah, so highly recommend hopewellnesscenter.com and hopewellness.com. Funny how he's got to have 2 different websites, 2 different clinics, 2 different places to do his work. I wanted to ask him about why, the Mexico thing. I'm just curious, from a political perspective, why Mexico allows all this kind of thing. I mean, does that have anything to do with their political state? I mean, why do they allow all this holistic natural health?
Yeah, I mean, everyone in our area. I mean, anybody that's close to Mexico or Canada seems to
just go to those 2 places.
Go.
Yeah, because
it's like they don't have a need for the U.S. anymore, what they have to offer.
Well, it's funny, too, because when you have high-level pro athletes going to Germany to get stuff done, and they'll say in newspaper writings, in the, when these teams are playing, they'll talk about how these star athletes are going over to Germany to get procedures done that they can't get here. And that's the extent of it. No one asks, well, why is that? And nobody on TV will say, well, what's going on there? Why are these pro athletes? And it's like the buck stops and move on to the next topic. And,
nobody ever digs. Nobody ever. I mean, if it's not good enough for them in the U.S., it's not good enough for anybody. I mean, we're all the same bag of bones and tissues, and we all need that kind of care. I mean, obviously, if the best of the best are getting these best treatments, why are we going to the local, down the street doctor and just getting filled with a bunch of
chemicals?
Yeah.
What were you going to say?
I was going to say CRAP.
You
didn't hear it here, though.
You don't want to hear it? Well, thank you, everybody, for joining us. This is episode 249, and Kate took really good notes, so we're going to have all the links that Dr. HInes...
Well, thank you. I'm taking a bow.
We're going to have all the links that Dr. HInes mentioned on this show, so you don't have to take notes. You can just check out extremehealthradio.com/249. And then what I'll also do, too, is I'll put a link to the forum. In the forum, I'll create a new show thread, and you can continue any Lyme disease discussions or anything that Dr. HInes talked about specific to this episode in the forum. So highly encourage you guys to join the other listeners of the show. These people are just cutting-edge extreme health radio. They just know what they're doing. And so to have high-level people like this in our forum is just incredible. So I'd highly recommend joining. It's free, and you can interact with other people, other listeners, get your health questions answered. You can ask questions yourself and help others. So it's a great place for that, too. And it's Facebook free, which I kind of like.
That's refreshing.
Yeah, it's kind of nice.
Facebook free.
Facebook free. It's a Facebook free zone.
I like how the commercials on TV are like 0 calories or sugar free. It's like Facebook free.
Facebook free zone.
I love it. That's the way we're rolling these days.
That's the way we're rolling. But if you want to follow us on Facebook, you can. We're finding that all of our updates aren't getting sent to all the people that we have following us, so it's really challenging to get the word out. So I would highly recommend getting on our email list or some other way of joining us on Twitter until they shut that down so we can keep up to date with everybody. So if you like to do that, there's links for that. And again, this is episode 249. We're going to be on tomorrow morning at 9 a.m. Pacific, Monday, Wednesday, Thursday, Friday at 9 a.m. So you can join us in the chat room and pass the show on to your friends as well. And don't forget to check out our store and consider a donation if that's something that you are able to do. Even $5 or $10 helps. Every little bit helps. So please consider that if you can, because all of our shows are free. We do all this work for free. So that's just kind of what we want to do, and keep putting this information out so that it will help you guys. And so
empower you to empower others.
That's right. So in order to do that, we need donations or things like that. So if that's something you could do, cool. If not, no big deal. You pass the show on to your friends, and hope you guys enjoyed the show. We'll catch you on the next episode.
Thank you for listening to this episode.
It's time to go for now, but our mission does not end with this show.
Justin and Kate will be back with another interview packed full of ideas, discoveries, and unique ways to regain your health.
Head on over to extremehealthradio.com/subscribe and instantly download our free gift too that contains cutting-edge strategies to start making healthy lifestyle changes today.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even as you educate yourself in the field of live food nutrition and alternative medicine. I'm not a doctor, nor am I offering readers or listeners medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog and during this podcast is discussed in the context of numerous conditions, it can be dangerous to take action based on any